Everyone, welcome to our Panhandle Health District update. It is January 23, 2024. The time is 1:33 p.m. I'm calling this meeting to order. In attendance are Commissioners Brooks, Matari, and Duncan. Are there? Oh, all right, public comment? None. And our one and only item is Panhandle Health District quarterly update with District Director John Duffy.
Thank you, Commissioner. As always, we really appreciate you affording me some time to give me an update on what's happening at Panhandle Health District. And I do have some things I'd like to share with you today. And of course, most important, I want to hear your questions and any concerns that you might have. We're going through LUMA transition. I don't know how much you're aware of that, but that is the state, after 20 years or more, are implementing, and started in July, implementing their new ERP system, which means it's basically accounting and human resource software. And that has been challenging for sure. But we're still behind it. It's going well. I was very, very happy that at our board meeting this week on Thursday, we'll be able to present our first financial statements since the implementation of LUMA happened last July. And I can't tell you how disconcerting that was not to be getting regular financial reports on how the health district is doing. But I'm happy to say we're doing very well in terms of our budget. So pleased with that. We're making progress, but it has been slow. And I suspect that I don't see any significant repercussions from this. In fact, there is some thought that we're going to find some significant efficiencies with this system. We were shuffling so much paper prior that we're hopeful that we'll see some efficiencies with this new system. And but I think, to be truthful, it'll probably take another 6 months before we're comfortable. And you know, any significant software transition takes a year. And so we're moving along. There have been some elected officials and some state organizations that want to do away with LUMA, but I think we're far too down the road for that to happen. I certainly would hate to start a new transition to some other software. So just an update. And on the heels of that, those financial reports, we now are coming on our FY25 budget preparation. We're already in the throes of that. As you know, our budget is a fiscal year. It begins July 1. So we're in the process of putting that together. And we will be coming back to you. My next meeting with you will be presenting the draft budget. And then, as you know, at the end of May, we have our budget hearing where Commissioner Duncan will represent Kootenai County on the vote for that budget. So, as always, our budget really comes down to what can we do for the employees, and that's, you know, over 70% of our budget. And I really don't know at this point what we may or may not be able to do with our budget going forward in terms of their salaries. So we'll have to wait and see, but we're looking into that. We have one very positive thing with our financials is that we will pay off our Hayden building in August. We'll make the last payment for that building, and that'll save us several $100,000 a year, and we may be able to use some of that. So we'll kind of wait and see how that moves going forward. But we're putting all those pieces together. We continue to work with our opioid settlement funds. Every January, we send out to all of our community partners applications that they can apply for those funds. Not all of them, of course, but for some of those funds going forward. So we're looking forward to that process. We had, I think, six organizations that we awarded last year. They're using those funds efficiently. And so we look forward to this coming year to distribute those funds to community partners. And this is throughout the 5 counties here in our district that can take advantage of these funds. We continue to actively use those funds right now. We're meeting with, and have met actually, with all of our school superintendents to talk about how these funds can be used within the schools. And we've just had great dialogue with them. And they're quite excited that they can implement some programs that hopefully won't take a lot of time away from the work that they do, and that the funds can fund that work for them. So you'll be seeing more of that going forward. We just completed our strategic plan for this year. We're happy with the things that we're looking at there. And just so for your information, one of my objectives is to do a better job helping our board members on our Board of Health become more engaged in the work that we do. You know, right now our Board of Health members come to 7 meetings a year, and really that's the end that we hear from them. So I will be, we're at our board meetings, we're going to do a little snippet each board meeting to help them understand their responsibilities being on the board and how they can be more actively involved on the board. And then I will be meeting with them individually every 6 months to speak with them. Finally, before we finalize our agenda, I'll be sending it not just to our chair, but to all the board members to see if they have some items that they want to add. You know, for example, we just had Dr. Johnson call me yesterday to say, hey, I've got something for the board meeting. Well, the board agenda was already out, so we couldn't add that to it. So again, all of this is an effort to help them better understand their job, be more engaged, and really more proactive on our Board of Health. So I'm looking forward to that change over the coming year. We completed our employee survey in December, and we found that 81% of our employees are very happy to work for Panhandle Health District. We had 19% that were more average. We wish that that was less than that, but that's probably not uncommon. It's an area that we always work on, that people feel valued and safe at Panhandle Health District. But again, a large majority of our staff are happy to be there. And we'll continue to try to continue that feel, but also help those that might not feel that way. And finally, I wanted to talk a little bit about our community health assessment. Every 5 years, Panhandle Health District conducts a community health assessment. And we do that in conjunction with several partners, including Kootenai Health. And this is very important for Kootenai Health because they are, as you know, moving to a non-for-profit status, and that now requires them to do a community health assessment. So this works very, very well with them. They, in fact, even paid for 1/3 of this cost for us to conduct this community health assessment, even though this health assessment addresses all 5 northern counties. In past years, we ourselves as employees conducted this. This year, we actually contracted with a company who does community health assessments around the country, a company called Crescendo, and frankly, they did a better job than we did, and we saved over $20,000 using them as opposed to doing it internally. So what I have here for you is, this is a copy, if I may approach you. This is a copy of our community health assessment, and no fear, I'm not going to go through all of this with you here today. But our goal behind a community health assessment is to identify the needs of our community and then create our strategic plan is based on that community health assessment. It's not just follow the money, it's not just do what we think is cool, it's finding what our community really needs. And in this health assessment, it was found that the 5 areas of biggest concerns to this community are housing and homelessness. Nothing of this will be too much of a surprise to you, I'm sure. Behavioral health, or the lack of healthcare providers in that area, and healthcare access in general is another concern, followed by youth services in our community, and finally transportation, were the 5 areas that this very detailed and statistically significant study found in the work that we did here in District 1. Now, some of these areas we can have an impact on. I'm not sure how much impact we can have on housing as a health district. Certainly it's part of a discussion within our regional behavioral health board. And transportation, how much can a health district really affect that? But certainly behavioral health, access to care, and youth services, we can have an impact. And remember, when I say we, I'm not just talking about the health district. I'm talking about all of our community partners that can assist us with this. Excuse me. So what comes next after what we call the CHA, or the Community Health Assessment, is our CHIP, which is a Community Health Improvement Plan. Taking what we've learned from the CHA and creating a health improvement plan associated with at least most of these 5 areas that I've addressed. And that CHIP will be completed in March of this year. And what we hope to do when that is done is basically take this on the road, to visit with as many people as we can in the 5 northern counties to talk about this community health improvement plan, to get buy-in and to begin these services associated with this. So this is a very important year for the health district. Again, this is only done once every 5 years, and we look forward to presenting this out into the community. So any questions you have as I've babbled on here for a while?
No, Bruce?
I don't have any questions. Thank you.
Okay. Anybody?
Any other ways we can help you?
I'm sorry?
Any ways we can help you?
Yes, I mean, if you have any groups that would be interested in hearing about either our CHA or our CHIP, we would love to talk to any community organization, and I mean anyone that's willing to have us. We'd love to come in. It's not just me, it'd be myself and other community partners to present this to them so that they are aware and get feedback from them. So any contacts you have would be helpful.
All right.
Commissioner Duncan, that's the end of my report.
All right. Thank you very much. Public comment? Is anybody on the phone or online? Nope. All right. 1:45, meeting adjourned. Thank you.
Thank you so much.
Thanks, Don.
Appreciate it. You bet.